Understanding Stress and Its Impact on Health by Nikki Rudy, Professor Benjamin Butters. The definition of stress is a physiological and psychological response to external pressures or challenges, often called stressors. It affects the body and mind and can be triggered by factors such as work, pressure, personal conflicts, or health problems. An overview of stress is that stress affects multiple body systems, including the musculoskeletal, cardiovascular, digestive, respiratory, and nervous systems. Stress can be acute, which is short-term, or chronic, which is long-term. Chronic stress can lead to serious health issues like anxiety, depression, and cardiovascular disease. In this diagram, it points out the different parts of the bodies that can be affected by stress. For example, stress can trigger headaches and intensify tension headaches. It can increase depression and wear you down emotionally. Stress can increase the production of stomach acid, which could lead to heartburn and make it worse. Stress makes it harder to fall asleep and stay asleep, which can lead to insomnia. Long-term stress weakens your immune system's defense, leaving you more vulnerable to infections. When you're stressed, the muscles that help you breathe tense up, which can leave you short of breath. Over time, an increased heart rate and blood pressure damage your arteries, which could lead to a heart attack. Stress causes your liver to release extra sugar, glucose, into your bloodstream, which over time puts you at risk for type 2 diabetes. Stress hormones make your heart pump faster so that blood can quickly reach your vital organs and limbs. Stress hormones tighten blood vessels, which can raise your blood pressure. Stress affects your body's digestive system, which can lead to stomach aches, nausea, and other tummy problems. Stress and the fatigue that often comes with it can take a toll on your libido. Stress makes muscles tense up, and chronic stress can lead to tension-related headaches and backaches. Stress interferes with the reproductive system in both men and women and may make it harder to conceive. Your brain plays an important part in the process of getting an erection. Stress can interfere with this process. Fluctuating hormones can throw your menstrual cycle off, or in severe cases, stop it altogether. Why did I choose the topic of stress? Stress is a widespread issue impacting millions of individuals worldwide. It has significant effects on both mental and physical health. With the increasing demands of modern life, such as work, school, and family, understanding and managing stress is more important than ever. In the graph shows the blue line, which is the perceived healthy level of stress. The red line shows the average stress levels and the years associated with it. As you can see in the graph, the average stress level is much higher than where it should be. What happens in the body? Fight or flight response. When stressed, the body releases hormones like adrenaline and cortisol, preparing the body for immediate action. Stress can have negative physical effects, such as musculoskeletal tension, headaches, and pain. Cardiovascular, increased heart rate, high blood pressure. Gastrointestinal, upset stomach and digestion. Nervous, anxiety, and difficult concentrating. There are also chronic stress effects, such as long exposure to stress can lead to more severe health problems like heart disease, digestive issues, and mental health disorders. The impacts of media, culture, and technology. Media influence through social media can often create unrealistic expectations and promotes comparison, leading to higher stress levels. The news and entertainment often focus on sensational topics, contributing to a heightened sense of anxiety. Cultural pressures to exceed or perform contribute to stress, especially in competitive environments. Technology's role is that we have constant connectivity, such as emails and messages, which leads to a work-life imbalance, sleep disturbances, and burnout. You have immediate news at your fingertips. When the latest news is released, it is fed to you via your phone. Comparison through social media's highlight reel can also play a factor on your levels of stress. The importance of addressing stress. Why is it important to address stress? Chronic stress is linked to major health issues like depression, heart disease, and sleep disorders. Addressing stress early can prevent long-term health complications. Managing stress improves overall well-being, productivity, and quality of life. In this image that I have shown, this is a pamphlet that says, "My mental health, do I need help?" Oftentimes, if your stress gets too high, it can lead to anxiety. So by following this pamphlet, it will tell you if you are ready to seek professional help to deal with your stress. Well-being habits to impact stress or to reduce your stress. Positive coping techniques include exercise, meditation, and relaxation techniques that will reduce your stress levels. Developing time management skills and setting boundaries helps manage work-related stress and stress from peer pressure. Social support and discussing stress with loved ones can be effective coping mechanisms. Some wellness habits that we've learned from this course that can help you reduce your stress include mindfulness and practicing mindfulness to stay grounded and aware of your stress triggers. Physical activities and regular physical activities help reduce stress hormones and improve your mood. And proper sleep is crucial for stress management. Mindfulness is like giving your brain a little break to focus on what's happening right now. You can practice mindfulness in different ways, like paying attention to your breathing, feeling the warmth of the sun on your skin, or listening carefully to the sound of nature. Paying attention to positive feelings and thinking about good things in your life can help you develop a positive mindset, which helps reduce stress. There are some positives and negatives of stress. For example, some positives of stress may be that it's motivational. Short-term stress can help you meet deadlines or rise to challenges. Stress can also be positive because it can create focus. It helps sharpen focus and performance in certain situations. For example, during a presentation. The negatives of stress, that it does cause health issues. Prolonged stress can lead to mental health disorders such as anxiety and depression. Physical symptoms include headaches, high blood pressure, and digestive issues, as well as many other that we have covered already in this slide. Influence or challenge of faith from stress. For many, faith offers strength and resilience when dealing with an abundance of stress. Practices like prayer or meditation can provide emotional relief. In addition, communities within the church can offer social support, reducing isolation when faced with a challenging time or an abundance of stress. Some challenges with your faith. For some, an abundance of stress may lead them to question their faith or experience spiritual distress. Important takeaways and next steps. Here are some key takeaways from this presentation. Stress is a normal but complex response to external pressures that can seriously affect your health. Stress management techniques such as mindfulness, exercise, and proper sleep are essential for maintaining a healthy well-being. Next steps. Learn to identify your personal stress triggers and incorporate stress management practices into your daily life. Finally, it is important to seek professional help if stress becomes overwhelming. Thank you for taking the time to watch my presentation. Here are my references.